Hi, we're Team I, and we're going to be presenting Chapter 26, Value-Added Services as a Component of Enhancing Pharmacist Roles in Public Health. My name is Reagan Weaver.
My name is Ahmed Aldana.
Elisa Ruggiero, Dorothy Arner, Moiz Arsha,
and Brittany Hannett.
Introducing the case scenario. By all accounts, Alan Bouchard, PharmD, was a great pharmacist. He graduated at the top of his class in pharmacy school and started a successful career in pharmacy chain in the suburbs of Chicago. While he enjoyed working with all his patients, he especially liked counseling children and their parents. He had a reputation of being great with children and informative to the parents, which resulted in many referrals to the pharmacy where he worked. Last year, Dr. Bouchard's wife was offered a job opportunity in Phoenix. While he loved his job in Chicago, his wife's opportunity was too good to pass up, and he knew that there would be positions available in Phoenix area in his pharmacy chain. He arranged for a transfer to another pharmacy in his chain in the Sun City, a suburb just northwest of Phoenix. When he arrived, he was anxious to further develop his pediatric services that he had started in Chicago. He had convinced his pharmacy manager to purchase special equipment to teach children how to monitor asthma, to remodel the pharmacy to include a private counseling area to spend more money in promoting these services in the local community. After 3 months, Dr. Bouchard was disappointed in how the services had received. On a good week, only 1 to 2 persons would come in for services, and they were often older customers seeking advice for their grandchildren. The pharmacy manager began using the private counseling area to store diabetes supplies, which always seemed to sell more fast and the pharmacy could get them in. Dr. Bouchard did not understand why his services, which were so successful in Chicago, were not nearly as well received in the Sun City. He often wondered what he could do to increase the appeal of his services to the larger number of pharmacy customers.
How does an organization's strategic plan affect the kinds of goods and services it offers? Many pharmacists develop goods and services based primarily on their own desires or the needs of their organizations. They have a personal interest in a particular area, or they have learned how to provide a specialized service that they want to provide at their pharmacy. This, however, is a mistake because these programs are based on one person's interests, not necessarily the interests of consumers. When planning what goods and services to offer, it is important to identify the potential consumers and develop a plan around those consumer needs. By using the business planning process, it can help identify risks and identify if a product or a service will be successful. One of the first steps in creating a business plan is to create the strategic plan of the business, which creates the goals and the plans for the development of this business. When implementing a new service or offering a new product, it must be assessed in terms of the strategic plan by asking how the good or service will help the organization to achieve the goals that have been set out in the strategic plan.
How can value-added pharmacy services benefit the needs of populations in addition to those of individual patients? Pharmacists can add value-added pharmacy services which benefit populations as they ensure safety and effective use of medications for the community they serve. Pharmacists are educators and advocates for their community's health needs. For example, pharmacists provide health and medication information to both patients and other healthcare professionals. Patients go to the pharmacy to get advice from the pharmacist on a walk-in basis without an appointment. There are over 60,000 community pharmacies which are open with little to no cost when they triage the medical problems of patients who come to seek advice. Pharmacists serve the needs of the public by utilizing health resources efficiently, by recommended treatment with an over-the-counter product, and referring to other healthcare professionals. In total, there are 3 functions of public health that are established by the Institute of Medicine, and they are assessment, policy development, and assurance. Pharmacists are actively involved in researching for ideal treatment regimens and identifying adverse events and medication errors. This helps to improve health outcomes for the society and individual patients. Pharmacists are leaders in their communities and play an integral role in developing and advocating for policies which improve health at large. Pharmacists help communities at the macro and micro level by designing drug benefit plans, educating others on medication use, speaking to community groups, and conducting health screening programs. Pharmacists have also served on local public health boards to emergency preparedness programs, which help to assure access to medications and health services after disasters. Pharmacists have taken also a major role as immunizers in which they educate individuals and the public regarding the risks and benefits of immunizations. Ever since the ability of pharmacists to immunize, around 30 million patients per year get vaccinated. This proves that pharmacists have improved the health of the society and decreased chances of complications from preventable diseases. Pharmacists have helped with substance abuse education, prevention, and treatment by expanding the naloxone access in community pharmacies to help with drug overdoses. Also, pharmacists continue to help with medications and syringe disposal services to protect the environment.
In what ways is business planning useful in the development of value-added pharmacy services? A business plan is very useful in developing value-added pharmacy services in key ways. It can help to evaluate if the business will meet the needs of the customers by employing a SWOT analysis, which is a valuable evaluation tool. It can also account for the fact that value-added services often require not only the pharmacist but also staff to have knowledge and skills beyond those traditionally needed. Business planning can also be used to appropriately staff a pharmacy to undertake value-added services. For example, a pharmacy manager may look to hire pharmacists who are interested in and able to provide vaccines to patients in an effort to increase profit for the pharmacy. Value-added services often need private areas within buildings to be conducted in. Creating these areas is often extensive and requires a great deal of prior planning. Pharmacies also need to be prepared to commit money towards creating new programs. The budgeting for running the program, startup capital, and marketing should be all covered in a business plan as an assessment of the viability of a program.
In addition to patients, who else should be considered consumers of value-added pharmacy services? There are three groups that the value-added pharmacy services can be classified into. Besides patients and caregivers, there's physicians and other healthcare workers that include specialists, physician assistants, nurse practitioners, nurses, dentists, veterinarians, and then payers such as private insurance companies, HMOs, PPOs, and accountable care organizations or government programs. Farmers should always consider all the needs and characteristics of each group in the business planning process.
What information should be gathered before making a decision to offer a value-added service, and where and how can this information be gathered? Pharmacists first think of patients and gather information from patients before making a decision to offer a value-added pharmacy service. After all, pharmacists do interact with patients on a daily basis, especially at community pharmacies. Information can be gathered from patients with particular disease states, patients not well controlled on existing therapy, and caregivers of the elderly and children. An example is an asthma service for patients with asthma and pulmonary conditions. These particular patients would likely have a much higher need for the service than patients without these conditions. Although patients are essential to the success of most value-added services, other groups of consumers may also benefit from pharmacy services too. Pharmacists must develop relationships with other health professionals to implement a new professional service.
Revisiting the case scenario. After assessing the market for diabetes education services, Dr. Bouchard took a closer look at the environment. In his pharmacy and organization, the outlook appeared to be fairly positive. While he was not a diabetes expert, he spoke with another pharmacist in the chain who had become a CDE. The chain had supported his training and even helped to pay for part of his certification fee. Dr. Bouchard always had been willing to learn more, so he decided that he would start the certificate process on his own. The pharmacy already had a private counseling area, and he figured that he could use some of the resources he had obtained with the pediatric asthma service for the diabetes service. When he told his pharmacy manager about the idea, she seemed excited, especially when given the potential for the service to attract new customers to the pharmacy. She did stress her budget to support the service and was limited, and that she would have to provide more financial projections that she could share with her district manager before she could commit to the service. There were threats that could have impact on the service, but none of that he felt could have not been overcome. There always seemed to be more prescriptions to be filled, and reimbursements for dispensing were decreasing as a result of the Medicare Part D programs that so many of their patients participated in. However, he knew that his chain was developing new technologies that would speed the dispensing process, and that his state had just changed his pharmacy practice to allow pharmacy technicians to perform more functions. He figured that these changes should help to free up more time that would be needed to develop, market, and implement, and ultimately provide a diabetes education service to his patients. Dr. Bouchard investigated the first steps that he could take in developing a diabetes education service. Through his contacts with his local public health department, he was able to identify senior centers and community groups that were interested in learning more about the health-related matters. Dr. Bouchard created a series of 20-minute health education presentations and aimed at the general public, one of them focusing on preventing diabetes and another living with the healthy lifestyles with diabetes. He began visiting a local senior and community center to give these presentations. These presentations included diabetes screening and the risk assessments so that participants could gauge their need for additional health services. Finally, Dr. Bouchard began the process of becoming a CDE. This would allow him to not only bill for services he would be able to provide for his patients, but also visit local physicians, nurses, and other healthcare professionals to keep them up to date on the latest advances in the diabetes therapy.
We are Team I, and we want to thank you for listening to our presentation on Chapter 26.